This is Rob Ferre, an emergency medicine physician and point-of-care ultrasound enthusiast. Today, we are going to review how to determine, based on your point-of-care ultrasound exam, if your patient has hydronephrosis. When performing a point-of-care ultrasound exam to determine if hydronephrosis is present, what exactly are we looking for? When imaging the kidney to assess for hydronephrosis, we first need to identify the two distinct sonographic zones of the kidney, the outer renal parenchymal zone and the inner renal sinus. Basically, I like to think of it as a Twinkie. You have the outer cake layer and the inner cream-filled center. The inner cream-filled center, or renal sinus, changes in appearance as we age or become more obese. As we age or become more obese, we begin to have fatty infiltration of the renal sinus. As fat accumulates in the renal sinus, the sonographic appearance of the sinus also changes. It becomes brighter and more echogenic. The distinction between the two zones becomes even more apparent. Let's look at these two examples. Both have no or very little fatty infiltration of the renal sinus. However, in both, the outer renal parenchyma still differs from the internal renal sinus. In the image on the left, you can see the collapsed calyces within the renal sinus. These calyces clearly are brighter or more echogenic than the outer renal parenchyma. In the image on the right, the individual collapsed calyces are less obvious, but the sinus is more sharply demarcated due to some early fatty infiltration of the renal sinus itself. The greater the fatty infiltration of the renal sinus, the more obvious the two sonographic zones become, as in this example where we have a very bright, echogenic, and full renal sinus. Just remember this: too many Twinkies, and your kidney begins to look more and more like a well-filled Twinkie itself. Basically, hydronephrosis is simply dilation of the renal sinus with urine. It is caused by some type of obstruction to the normal flow of the urine down the ureter. This results in urine collecting within the renal sinus and causing the renal sinus to dilate. On ultrasound, because urine is anechoic or black, it appears as an anechoic area within the renal sinus. Maybe we can think of it as a dark chocolate-filled Twinkie. So remember, the normal renal sinus will not have any evidence of dilation of the renal sinus itself. Although there's trace amounts of urine within that sinus, we cannot see that on ultrasound. However, with hydronephrosis, some type of obstruction exists, and this becomes evident as urine fills and distends the renal sinus, as in this example here. When the urine has filled the renal sinus and is causing distension, we see this as an anechoic area filling the renal sinus. As we take the probe and fan through the kidney, it is more obvious as we are able to image the central area of the renal sinus itself. As we move the transducer and fan to the side of the kidney, the urine-filled sinus is less obvious. Let's compare and contrast. The image on the left shows a fat-filled renal sinus, but there are no anechoic areas within that renal sinus. We can assume this means that urine is flowing down the ureter unobstructed. On the right, however, we have a dilated renal sinus indicating some type of obstruction to the outflow of urine. Another example. Again, on the left, we have a normal kidney without a dilated renal sinus. On the right, the renal sinus is anechoic. Hydronephrosis is indeed present. How about that fat-filled renal sinus? How does it look like when filled with urine? Well, in this example, you can see it is still quite obvious. The renal sinus is now filled and dilated with urine that is anechoic. One last final example. As we fan the probe back and forth, we again see the outer renal parenchyma and the inner renal sinus. This inner renal sinus is dilated and filled with anechoic urine. In summary, when we visualize the kidney on our point-of-care ultrasound exam, we are looking for the two distinct sonographic zones, the renal parenchyma and the inner renal sinus. Hydronephrosis is simply dilation of that renal sinus with urine and appears black on our ultrasound exam. Great job! Now that you can determine if hydronephrosis is present, we are ready to move on to grading that degree of obstruction in our next module.